In the last conversation, we spoke about who is a pathologist, what role does he play in a patient's life from diagnosis to treatment, and how about lung cancer early detection and what is the pathologist view on it. Today, let us converse about what are some of the newer technologies in detection of lung cancer, and let's start with biomarkers. Can you tell us about biomarkers and what is their role in diagnostics in pathologist lab today?
So what is a biomarker? So biomarker are substances which are found in blood or body fluids which can be detected even before patient has symptoms or even before the cancer is detected on an imaging based technique. So biomarkers provide a non-invasive method of detecting early detection of cancer, and there are various biomarkers like blood-based biomarkers which we can detect circulating tumor cells or circulating tumor DNA, which are cells which are shed from the tumor into the bloodstream. Others are miRNA. Few tumor markers can be used as biomarkers like CEA and CYPRA21-1. These are emerging markers, but they have a downside that they are not very specific for lung cancer. But they can be used as a prognostic marker as well as a response to treatment marker. Levels of these markers are high, and after treatment they are decreasing. Then we can conclude that the treatment is effective.
Okay.
Other new emerging biomarkers are also coming. They are pro-GRP and autoantibodies to tumor antigens. So these are all under research, but we are very hopeful that new markers are coming.
So when we adopt newer technologies like biomarker-based detection, even radiological detections, we talk about merging artificial intelligence, machine learning methods to increase the accuracy of these diagnostic procedures. What are your thoughts about it?
Definitely artificial intelligence, machine learning and image-based analysis is coming in a big way. So using image-based analysis, we can diagnose the cancer as well as quantify the cancer, and using pattern recognition, some of the patterns we can use computer algorithms to differentiate the tumors histopathologically, which inherently have different prognosis. Also, AI and machine learning helps in standardizing the diagnosis. So there is no interpathologist variation in diagnosis, and it can help in even we can store the slides. High resolution slides are made of histopathology sections, and we can send them for second opinion.
Okay.
So that is a very good advantage for getting second opinion instantly.
Okay.
That too from a very good, very expert pathologist.
Okay. Even anywhere in the world. That's good. So when we talk about using computer algorithms or newer computer methods to integrate into this basic procedures of diagnosis, are there any challenges in implementing these in the current diagnostic lab regimes?
Right. So as I said that these are high resolution images. So it takes a lot of cloud storage. Secondly, the cost is a very important factor, especially in an Indian scenario.
Right.
Third is the resistance of the senior pathologists or the lab technicians also to adopt to newer methods.
Right.
Also, we need to increase the infrastructure so that we are more trained on using such newer techniques. Fourthly, patient data security is a bigger issue. We don't want to the confidentiality is the biggest virtue of a doctor.
Correct.
So we don't want the data to be used for other purposes. So that is one of the bigger issues.
Correct. These are some of the important challenges you mentioned, and anyone who's developing newer techniques must keep these challenges in mind and address these challenges so that it is widely adopted by the community. Okay, this brings me to my next question about how do you think about an interdisciplinary approach of treatment or diagnosis, such as pathologist, primary physician, oncologist, how they should collaborate with each other for the patient's good?
Yes, so it is extremely important for a collaboration role of a pathologist, a radiologist, and an oncologist to exchange their views on that particular case, so that patient gets a personalized treatment plan,
Right.
and which is accurate and effective.
Right.
So a pathologist basically provides an definitive diagnosis.
Correct.
A radiologist, a pathologist also provides staging and grading of the tumor, the extent of spread. Whereas a radiologist performs CTs, PET scans. Even the smaller lesions or non-cancerous looking lesions can be diagnosed as cancerous lesions by a radiologist.
Correct.
As well as metastatic spreads can be detected by a radiologist. And collective data of pathologist and radiologist is used by oncologists to plan the effective treatment for each patient, and it helps in patient care, definitely.
What do you see as the future of pathology in early detection of cancers? We can take any cancer for this matter, because the conversation must not limit to lung cancer, but in the early detection regime of cancers, how do you see the role of pathology labs?
Okay. So pathology labs are definitely adopting newer techniques like next generation sequencing, molecular tests, FISH and flow cytometry. But apart from that, artificial intelligence, image based analysis, it is also coming up in a big way. But exciting thing is using non-invasive techniques like liquid biopsies. We can directly come to a conclusion that what are the genetic profiles of this patient, the genomics of the patient, and we can plan personalized treatment for the patients.
Any final thoughts that you would like our listeners to take away in the Varsi Lung Empower Drive? We are trying to bring lung cancer awareness as much as possible,
Right.
asking individuals to know the symptoms, asking individuals to know what's going wrong with them, asking individuals to get aware of what will be the consequence if they do not watch their health.
Right.
Any concluding thoughts on this?
So it's advice to the patients that please stop smoking, using tobacco-related products. Know the symptoms of lung cancer, even if they are non-specific symptoms. If you are a high-risk patient, please go and screen yourself. Also, patients need to be made aware, which using this initiative, I am sure that patients are definitely getting more information on lung cancer, which is definitely one of the leading causes of mortality and morbidity.
Great. Thank you so much for this, Dr. Dhande. And this was our conversation with Dr. Ashish Dhande. And he gave some insightful information about what is the role of pathologist in this lung cancer early detection regime. And I'm sure with the newer technology research that is going on in India and abroad, together as a community with a lot of awareness, we can bring difference to the way we see lung cancer as a whole. Signing off, this is Dr. Manasi Khasnis.